All right, everybody, welcome to another targeted week. We're going to do 1 week each month targeting a special topic, and February is Dental Health Month for our pets, so this is our Dental Health Week. We've got an expert who will be joining us at the end of the week that I think you'll find very interesting, great guy. And so during the week, we're going to talk about causes, prevention, treatment. And today we're actually going to focus on, hi hair today, Ashley. Today we're actually going to focus on what actually is dental disease, because I think that there is a lot of confusion as to what is even defined as dental disease. And I think it's something that we don't talk about or think about enough. So, does your pet's bad breath keep you from snuggling? Do you kind of go ew when they get in your face? Believe it or not, doggy and kitty breath is not normal. They should not have bad breath. They should not have a bunch of stuff in their mouth, on their teeth. And so if they have bad breath, that can be one of the first signs that there is dental disease occurring. Periodontal disease is the #1 problem in small animal veterinary medicine. And it may affect up to 80 to 89% of dogs over 3 years old, and 70% of cats. And it's also one of the most overlooked diseases. Less than 4% of dog owners brush their teeth every day, and I can say for the kitty cats, it's going to be less than that. So that's a really small percent of of pet owners who are actually paying attention and getting in their pet's mouth and doing any sort of care for the teeth. And depending on the diet, and we'll talk about that throughout the week as well, the teeth may require more care than some other diets. So early signs of dental disease can include bad breath, yellow tartar buildup, red swollen gums. Do not overlook the gums. Even if the teeth look good, if we've got red inflamed swelling in the gums, we've got dental disease. Dental disease is painful, and it occurs when bacteria, plaque, and tartar build up on the teeth and get trapped beneath the gum line. And that is the key phrase, trapped beneath the gum line. The bacteria can be absorbed into the bloodstream and wreak havoc on other major organs throughout the body, particularly the heart valves, the kidneys, the liver, where we're doing filtering. Early detection is vital. If left untreated, it will progress to chronic pain and inflammation. And dental disease negatively impacts your pet's life. My veterinary business consultants wanted us to say to our clients, your pet's health is being ruined by his teeth. I had a hard time with that. I didn't want to be that in the face of my clients and have them hate me because I was telling them their pet's health was being ruined because they weren't taking care of their teeth. But in actuality, their health is being ruined. This is a chronic inflammatory condition. Chronic inflammation leads to other things. Cancer? We talked about that a few weeks ago. So dental evaluations with your veterinarian should be part of their annual exam at least, if not twice a year, and depending on their age. All right, I've got a whole bunch of notes here, so I just got to jump around. So periodontal disease occurs in 4 stages. We're going to talk about what those 4 stages are. The first 3 stages are treatable and potentially reversible, but the final stage of periodontal disease is not treatable and is not reversible. When it's untreated, periodontitis will lead to decay, tooth loss, severe pain, and systemic illness. Okay, so if dental disease is not discovered until we're in periodontal disease stage 2 or stage 3, we have a lot of catch-up ground to make up. And if we don't detect it early, then our pets are already experiencing chronic pain and chronic inflammation. Animals are really good at hiding pain. I was looking at one of our kitty cat's teeth the other day, and she has a nerve root exposed from a lesion at the gum line on one of her teeth. That tooth is going to have to be extracted. So she is dealing with pain. And the thing is, our animals will not tell us that. They will continue to eat. They will continue to chew on hard things even when they have significant dental pain and infection. Okay. So if you notice that your pet is shying away or they won't let you in their mouth, maybe because they've got significant pain and inflammation in there or loose teeth. Stuart has a loose incisor right now. He unfortunately absolutely cannot undergo anesthesia with his heart in stage D failure. But that tooth, I try not to get near it when I'm doing things in his mouth because I don't want to wiggle it around and make it painful for him. So, and we did hear from our clients very often when they brought their pets in and had their rotten teeth taken care of, that it was sort of like having a whole new animal when they got them home. They felt so much better, they were more active, they were more playful, because they weren't dealing with that chronic pain. So periodontal disease is an infection of the tissues that actually hold the teeth in place. So that's the gingiva, the cementum, alveolar bone, the periodontal ligament, the gingival sulcus, which is kind of the pocket, and the mucogingival junction. So those are all pieces of the gum, bone, tooth junction. And all of that plays important roles. And if we have damage to any piece of that, then we're going to have significant tooth loss. So the mildest form of periodontal disease is gingivitis. Unlike periodontitis, gingivitis is easy to treat and entirely reversible. Periodontitis, on the other hand, refers to the more advanced stages, and these stages are increasingly difficult to treat as the disease progresses. And by the end stage, the only treatment option is removal of the teeth. So if you're one of those people who hasn't done any care of your pet's teeth, and by the time you take them in for a dental, they come out with 20 or 25 teeth being removed, don't blame the veterinarian. Don't get mad. Just understand that those teeth were not salvageable. Veterinarians do not pull teeth if they're salvageable. We like to leave them in there for them to chew, but if they are causing pain, they're going to come out. So most often periodontal disease is the result of poor toothbrushing, no toothbrushing, or no dental care at all. But not all cases are that simple because there are other factors that can contribute to developing periodontal disease, including the breed of the dog. There are some breeds that definitely have more dental problems. For years in practice, it was kind of the running standard that if we saw a Yorkie that had any teeth left in its head at age 7, that was the miracle dog, because Yorkies have always been a breed that has significant dental issues, and a lot of times they're not real keen on having people in their mouth doing dental care, and so some of those smaller breeds are definitely more prone to dental problems. You can do genetic testing to see if your pet is prone to dental disease. We'll talk about that more Thursday. I think we're going to talk about it. But for cats on base paws, they actually give you the chances of your pet having dental disease. I think Gwen's 2 cats came back at like 94 and 98%, like crazy. She said, no wonder their teeth are so bad. No wonder they need dentals every 6 months. And then on the Embark DNA testing for dogs, they do have a test for enamel hypoplasia, which basically is not having good enamel, so the teeth are not as strong, and a lot of the smaller breeds are prone to that. And then the brachycephalic breeds have more trouble. Those with an undershot jaw, so their top jaw or teeth are behind the lower teeth. Their teeth don't meet correctly, they don't wear correctly, they are definitely more prone to dental disease, plus a lot of their teeth are in there sideways. If you look at pugs, the English toy spaniels, their teeth are not sitting lined up like ours would be, they're sitting in there sideways. And so they're not grading the way that they should be. And it traps more food and debris in there. Mouth breathing in those dogs can cause the mouth to dry out, and it's going to change the microbiome. We're going to talk about that on Thursday as well. And if the mouth gets dry, saliva plays a very important part in washing the teeth, rinsing away the bacteria. And so without that saliva and without that wet mouth, we get more food debris and bacteria stuck to the surface of the teeth. So the breeds that are more prone to periodontitis that was in this particular article are Chihuahuas, Yorkies, Maltese, Pugs, Shih Tzus, Boxers, and Dachshunds. I'm going to add the Cavaliers and the English toys onto that list as well. Their chewing behavior and diet also play a huge role in preventing periodontal disease. Normal chewing with a normal bite helps clean the teeth through abrasion. High quality natural diets are best for keeping the teeth clean. Soft foods tend to reduce the abrasive quality, potentially leading to less scraping action against the teeth. So I'm not saying that we should feed kibble. Kibble does not clean teeth. Kibble is worse for teeth. We're going to talk about that more on Thursday as well because of how it changes the microbiome. So feeding a species-appropriate diet is going to help keep the teeth cleaner without those starchy carbs, without those sugars. And then one of the other things that we see with chewing behavior, dogs who are voracious chewers that really like to chew on things that are hard, rocks, antlers, weight-bearing bones. We see tons of tooth fractures, the upper premolar in particular. Two of my dogs had fractures in lower teeth from aggressive chewing behavior. And another thing that you should not allow your dogs to chew on is tennis balls. The fuzz on the tennis balls erodes the enamel. It's like taking sandpaper to the teeth. So do not allow your dogs to chew and pull tennis ball fuzz. All right, so symptoms of periodontal disease are going to vary depending on the stage of the disease, but there are some classic symptoms: bleeding when you're brushing or just bleeding when you look at the teeth. Red gums, excessive drooling, difficulty eating, loss of appetite. This is going to be way late in the stage unless they've got a painful slab fracture. Bad breath, and being protective of their mouth. And at later stages, you might find that there are gaps where teeth have fallen out, or you may actually find some teeth that have fallen out. You might notice blood on the toys, blood in the water bowl when they get a drink. And if they normally let you touch around their mouth and suddenly they're not, then we've got some pain in there somewhere. So how do we diagnose this? We diagnose it through a dental exam. Your vet can suggest a diagnosis just by looking in the dog's mouth. So if we lift the lips and we see tons of redness, we see inflamed gums, we see big pockets around the teeth, we know we have periodontal disease. However, the visual exam alone is not enough. So if we open the mouth and we go, oh, look at those nice pretty teeth, no periodontal disease, we may be wrong. We very well could be wrong. So in a complete dental exam, they actually should take one of the dental probes and go along the inside and outside surfaces of the teeth and see how deep the pockets are along the gum line. Because if we have, and this is interesting, the new dentist that we go to down here in North Carolina, first time in my entire life I've ever had someone measure all the pockets inside and outside of every one of my teeth. And they put it in their computer system. Never had that done before. I cannot believe in 60 years nobody actually took a dental probe and measured the pockets around my teeth. So that should be done, and I frankly have never seen a veterinarian do that. So, but it is part of a complete dental exam. The gold standard for diagnosing periodontal disease is x-ray. This is why your dentist, every time you go in, they're like, you're due for x-rays, which, you know, I don't really want my head x-rayed twice a year, every year for my entire life, so I don't do it all the time. But by looking at the x-rays, we can see a root abscess. We can see where the tooth is pulling away from the bone. We can see where the bone might be starting to deteriorate and pick up things much earlier than waiting for the abscess to form because we've got that big pocket down in there. So, and unfortunately, the only way to x-ray your dog or cat's mouth is with them under sedation. We cannot get those x-rays without them sedated. Interestingly, we did a dental on a dog that cleaned up the teeth. They looked great. When the technicians were all done the cleaning, they took an x-ray and said, oh my gosh, this tooth in the back has a fracture in it, and it had a root pocket. We never would have known that just by looking at and cleaning the teeth without that x-ray. The tooth had to be taken out. We didn't know that that fracture in the tooth was there. So that's the only way you're going to find those. Okay, so, here's a good statistic. 75% of dental disease is located below the gum line. So what you're looking at on top, just on the crown of the tooth, is only 25% of what's going on. 75% of the dental disease is below the gum line, and we can only see that through the x-rays. After examining dental radiographs of cats and dogs with teeth that appeared normal to the naked eye, this is kind of like the case I was talking about, veterinarians found that 27.8% of dogs and 41.7% of cats had diseased teeth on the x-ray that they couldn't tell just by looking at and cleaning up the teeth. In pets with abnormal looking teeth, veterinarians found additional diseased teeth in 50% of dogs on x-ray and 53% of cats. So if your veterinarian is not taking x-rays as part of the dental treatment, they're missing 75% of what's going on in your pet's mouth. Okay. And then I had never heard of this before either. A diagnostic tool called a periodontal diagnostic strip. Now, I remember a dentist coming and speaking to my second grade class when I was, 8 years old, and bringing these little strips. So they had all of us brush our teeth, and then they had us, I don't know if it was a strip or something we swished in our mouth, but it showed all the plaque and bacteria as bright red that we had missed. It was amazing how much, as an 8-year-old, how well do you brush your teeth? But it was amazing how much was missed. So they have these periodontal diagnostic strips. I've never seen these used in veterinary practice, but I love the idea. The strip measures the production of thiols in your dog's mouth. It's chemical. The thiols are produced by the periodontal pathogens in your dog's mouth, so the bad bacteria. The strip confirms the disease, but it also reveals the severity. Using a strip is particularly helpful for dogs with dark gums, because you can't see if they're red or swollen as easily, and for evaluating small and toy breed dogs who may not be quite so happy about you getting in there and looking way in the back. So a periodontal diagnostic strip, I think, is pretty cool. All right, so periodontal disease is progressive, which is why early treatment is so crucial. So we're going to talk about the stages. There's 4 stages. The first stage typically presents with just gingivitis, so that you're going to see the red gums, the inflammation there. It's caused by a buildup of plaque on the teeth, leading to soreness and bleeding of the gums. Plaque is actually a biofilm formed by colonizing bacteria on the teeth, and it attaches to the smooth surfaces of the teeth. Hardened plaque then becomes calculus as a result of mineral accumulation from the saliva. So a lot of times we'll see animals that have these huge pieces of calculus, particularly kitty cats. And one of my favorite things to do in practice was to flick those big pieces off, and it's like, oh look, we got a pretty decent looking tooth under there. And the calculus is not what's causing the problem, because that's on the crown of the tooth. It's the bacteria that are under the gum line that are the problem. So the calculus is an irritant, but it's not the cause of periodontal disease. The degree of gingival inflammation is more indicative of disease than the amount of calculus present. So what we're really looking at is what do those gums look like. All right, in the second stage, that's an early stage of periodontitis and can still be treated. At this stage, there may be less than 25% of attachment loss of the roots from the surrounding tissues, and an x-ray will reveal early signs of disease. So this is where that periodontal, that dental probe can measure the pocket to see how deep it is and what the attachment level is of the tooth. There may be swollen gums, there may be worn crowns, but a worn crown is not necessarily a problem as far as periodontal disease goes. So having a complete dental done at this point, professional dental cleaning under anesthesia, can prevent further destruction and bone loss. This is where we still have preventable treatment that we can do to keep these teeth in place and prevent the bone loss so that the teeth stay secure in the mouth. And this is, if you haven't figured it out already, I am not a fan of non-anesthetic dentals because we can't get x-rays, we can't clean under the gum line, especially on the insides, under the tongue, getting on the inside of the teeth, getting all the way to the back of the mouth. There are very few animals who are going to allow you to probe and clean and scrape under the gum line. I have yet to have one that would tolerate an ultrasonic scaler with them awake. Don't recommend trying, it's not pretty. But you can't get those x-rays, so you're missing 75% of the disease. What you're getting when you do non-anesthetic dental cleaning is cosmetic. You are making the teeth look better. You are not treating periodontal disease. You may be making periodontal disease worse by scraping those teeth. Okay, the third stage comes with moderate periodontitis, and at this point there's 25 to 50% loss of attachment of the teeth. Radiograph will reveal significant bone loss as a result of the plaque under the gum line. You may get the recommendation that the tooth be removed, or potentially see a veterinary dental specialist, and that's who we're going to talk to on Friday. If the tooth is saved by specialist procedures and you're committed to regular care at home, periodontitis can sometimes be stopped from worsening, but this is a progressive disease. So stage 4 is the most advanced stage, and there's more than 50% attachment loss and a severe loss of bone on the x-rays. Any tartar on the teeth will be clearly visible and the gums will retract noticeably. Stewie's got some big time gum retraction from his dental disease. And at this stage, the affected teeth have to be removed. There's nothing you can do with them. Okay, once periodontal disease is diagnosed, treatment should begin as soon as possible. So we're going to remove the plaque from the teeth, which can reverse gingivitis, returning the gums to their healthiest state if we're in the first stage of periodontal disease. It should be done under general anesthesia. Like I said, doing anything without that is really just cosmetic. So periodontitis, when we get into the stage 2, 3, 4, we definitely need more aggressive treatment, scaling, planing, root scaling to get plaque from root surfaces, and then planing is the smoothing of the root surface. They can do bone grafts. There are different gels and something called console that they can put in there to try to reattach things, fill in defects if we're not in real late stages. For teeth with a poor prognosis, extraction is probably the only option. Periodontitis is not as reversible as gingivitis, so prevention is always the best policy. Okay, go to page 1. I did that. Okay. All right, so to recap. In some cases, periodontal disease is reversible. Gingivitis, which is the mildest form of periodontal disease, is completely reversible with treatment. A thorough dental cleaning can remove the plaque that is responsible for infection, and the second and third stages can also be treatable. And in some cases may not progress to stage 4 if you are really working on getting the teeth cared for. Okay, all stages of periodontal disease, even if we're in stage 1, which is just gingivitis, are painful. Even in the first stage with gingivitis, they have gum irritation, pain, bleeding gums. If you're brushing and you're getting bleeding, we've got gingivitis, we've got periodontal disease. If you, interestingly, in practice, a lot of times I would just take a cotton swab and press along the top of the teeth, along the gum line. The gums would bleed just by touching them. So if you're seeing bleeding, your pet needs to have professional dental care. Their lips might quiver when you get near them. They may have twitching, and if they get painful enough, they'll stop eating. Advanced periodontitis is definitely linked to life-threatening health conditions. It's painful. It contributes to heart, kidney, and liver disease. We get blood vessel damage and inflammation, damage to the heart, blood clots, kidney disease. So we can have devastating effects because we ignore the mouth. And remember, this is the #1 problem in small animal veterinary medicine. Okay, one study, how fast does periodontal disease progress? One study discusses the progression of dog periodontal disease. In the study, 35 dogs had at least 12 teeth progress to a later stage of periodontitis within 60 weeks. The progression rate was significantly faster in senior dogs. The study also states that the state of a tooth's gingivitis does not give any prediction for how long it will take to progress to periodontitis. So it is a very common disease. It is very common in our older pets. It's more common in smaller pets, and it advances much more quickly in our senior animals. So what I would recommend is that next time you go in for a veterinary exam with your pet, that you ask for a complete periodontal dental exam and look for periodontal disease. I understand, and we're going to talk tomorrow about the whole procedure from soup to nuts of getting your pet diagnosed, getting your pet in, getting them treated, and then what to do for aftercare. So we're going to talk about all that this week. But the most important thing is recognizing that our pets are underserved when it comes to dental care. So one of the things we are doing for the whole month of February is the Dr. Judy's Dental Health Challenge. We are using the dental drops on our dogs and cats. If you have a video or photo of you brushing your pet's teeth, using our dental drops, doing any kind of dental care, please send that to us. You might notice your pet being posted on Facebook or Instagram. And it takes 30 days to develop a habit. So we have a little chart you can download and check it off each day, or just get your calendar, your phone, whatever. Do their treatment, take a picture of the teeth before you start the month, take a picture of the teeth after you end the month. Get in the habit so that this becomes something that you are doing every single day for your pets. It can be very simple. It literally takes me about 10 seconds to do 4 dogs. It's just not that hard. The hardest thing is remembering to do it and being consistent. So that is our challenge for you for this month. And every day this week, I will be on at 10:30 discussing different parameters around dental health for our pets. So if you haven't done your pet's dental care for today yet, now would be a good time to go grab your dental drops or your toothbrush, if you're not at work, and take care of their teeth. Know that you've done it for the day. If you can do it twice a day, better.